Now, this next one, we get it quite a bit while we're talking to patients on the phone before they've actually come to visit our office. I don't typically get a ton of this question from patients who have been to our office before or who are regular patients of ours. But we do get a lot of people they've got a fear of the dentist, whether they had a negative experience earlier in their childhood or for some reason that something has happened in the past, or whether it has or not. We do get that question quite a bit. Patients who have a fear of the dentist, they want to know kind of what can be done and what do we do at our office to help kind of guide them through that and to make sure that that fear is something that we can definitely move past and get their regular treatments taken care of.
So a fear of the dentist is definitely a real thing. I have one patient, she's a nurse, and she gives patients shots all day long, and she is so afraid of getting them at the dentist. And she's like, I know it doesn't make sense. I do this all day long, but it's a real fear. And it definitely is a real fear. So one thing which I know we've kind of talked about it before, which is kind of my backstory and how I've had a lot of these procedures done on my own mouth. So I think it helps me to kind of show some empathy with you, what you're going through, because I know it's not necessarily the funnest place to be. Something else that kind of helps the patients, I think, is that I don't feel like I look like a very threatening person. So when patients are like, oh, you're going to be the one doing my work, for some reason that tends to calm them down a lot. Mm-hmm. Now, for those who are looking for some tips, so one thing, we had a patient who I think she brought a blindfold. She wore it the entire time. It was just she didn't want to know what was happening. She didn't want to see anything. She kept the blindfold on the entire time. I actually think we've had a couple patients do that, and that's what worked for them. For other patients, it's the sound that really bothers them. So I do not mind if patients bring headphones, and we have so many that do that, and they listen to their own music or a podcast or something like that. It helps kind of drown out the noise of our instruments. And I've had a patient say, well, what if I can't hear you, what you're saying? And I say, as long as you can keep your mouth open, we're good to go. So now we do have nitrous oxide, which is laughing gas, in the office. And that is helpful for those patients who they just don't like the dentist. It makes them nervous. It makes them sweat a little bit. That's not for the patient who their greatest fear in the world is the dentist. Nitrous oxide works a little bit for those patients who have like a moderate anxiety level. It really helps them kind of calm down. You'll remember the whole procedure on laughing gas. It just helps relax you a little bit. Helps you care a little bit less. Now, if you need some teeth pulled and you're like, the laughing gas is just not going to be enough, another option, we do have a doctor who does the sedation in our office where you will be asleep and you won't remember going through that procedure. So that's a nice thing that we offer now as well. I will say that for the most part, patients leave feeling, a lot less afraid than when they came in. Mm-hmm. And there are a lot of patients who just had a bad experience when they were younger. And they realized that we're not like their old dentist. We're not like that dentist that they went to when they were a kid. And a lot of the patients, too, are worried. They say, well, I had a dentist work on me, but I wasn't numb. I was in pain. He wouldn't stop. So I also use the hand signal with my patients. If they ever need me to stop, all they have to do is raise their left hand, and that's our sign, and I will stop. And I think that I honor that, and I think that builds trust with the patients too. And I think, it's been found that if patients have trust in you, their level of anxiety goes down. So, and I'm willing, we have seen a lot of patients with a lot of anxiety, and we work with them. Some dentists, they don't maybe necessarily want to deal with, it's extra work to treat those patients with anxiety. But we know how important it is. We know that it's a real fear, and we want to help patients keep their teeth as long as possible. And I've been in that chair on the other side of it. So come and see us. Come see what we're about, and see if it's the right place for you.
Yeah, I think that's a good tip. And for anybody who's not familiar with the procedures that Dr. Monica is talking about that she's had done on her own mouth, we do have a blog post that we wrote about that. It details all of the different things that she's had done, including root canals, retreats, crowns, fillings, actually removing her jaw and reattaching it to her face. So I will include the link for that below this video, and then we'll have the other videos for our FAQs lower on this page as well. I just wanted to kind of add to what Dr. Monica said earlier, is that our secret weapon that we have, in addition to all those options that she told you guys about, is our team. They understand completely what it is to have anxiety and, to maybe not feel as comfortable. So it's not just Dr. Monica who goes the extra mile to make sure that you guys are comfortable. It's everybody that we've got on our team. If you want to see kind of who those folks are, I can include the link to our team bios on this page as well. So thank you guys for checking out this first FAQ video. Thank you, Dr. Monica, for answering some questions for us, and we'll see you guys next time.
Thanks, guys.
See ya.